Assalamu alaikum dear students. Today we will discuss ABO blood system MCQs part 2nd. Universal blood donor for the ABO blood system is option A AB positive, B AB negative, option C O negative, and option D O positive. So the correct option is C O negative. Which of the following is a test performed by the blood center to prevent disease transmission? Option A HBsAg, hepatitis B surface antigen. Option B ABO. Option C hematocrit, and option D hemoglobin. So the correct option is A HBsAg. Subscribe now and press the bell icon. Never miss an update from a technologist. The volume criteria of the anticoagulant in the triple bag is option A 70 ml, B 65 ml, C 85 ml, and option D 60 ml. So the correct option is A 70 ml. Cross match will be done before the issue of platelet if red cell contamination is option A more than 2 ml, B more than 5 ml, C more than 6 ml, and option D more than 8 ml. So the correct option is A more than 2 ml. Which tests are not performed for donor screening? Option A HB core antigen, B HIV, option C HCV, and option D MTB. So the correct option is D MTB, Mycobacterium tuberculosis. Donor samples must be stored in the transfusion service for what period after transfusion? Option A 2 weeks, B 7 days, option C 3 days, and option D 1 month. So the correct option is B 7 days. Which of the following is the minimum weight for a routine blood donor? Option A 45 kg, B 50 kg, C 55 kg, and option D 60 kg. So the correct option is option B 50 kg. For a donor, the systolic blood pressure must be in the range of option A 80 mm of mercury, B 100 to 180 millimeter of mercury, C 60 to 100 millimeter of mercury, and option D more than 180 millimeter of mercury. So the correct option is B 100 to 180 millimeter of mercury. So which of the following is the only serological test that must be repeated or counter checked by the reverse method? Option A RPR, B ABO or RH typing, C antibody screening, and option D compatibility test. So the correct option is B ABO RH typing. Antigens are option A found on the surface of red cells, B found on the surface of platelets, option C develops in response to antibody. So the correct option is A found on the surface of red blood cells. Which temperature are fresh frozen plasma FFP is stored for 1 year? Option A -12 to -25 degrees centigrade, B -15 to -50 degrees centigrade, option C -18 to -55 degrees centigrade, and option D -20 to 58 degrees centigrade. So the correct option is C, minus 18 to minus 55 degrees centigrade. The ratio of the donor cell and patient serum and compatibility testing is option A 1:1, B 1:2, C 2:1. So the correct option is B 1:2. Which of the following antibodies is capable of cross placenta? Option A IgA, option B IgG, option C IgM, and option D IgE. So the correct option is B, which is IgG. Which of the following antibodies is tin binding site? Option A IgA, B IgG, C IgM, and option D IgE. So the correct option is option C IgM. The angle for phlebotomy is ideally option A 30 degree, B 45 degree, C 25 degree, and option D 55 degree. So the correct option is B 45 degree. Packed red cell shelf life and storage temperature is option A 2 to 6 degrees centigrade for 30 days, option B 20 to 24 degrees centigrade for 35 days, C 2 to 6 degrees centigrade for 35 days, and option D 2 to 6 degrees centigrade for 1 year. So the correct option is C 2 to 6 degrees centigrade for 35 days. FFP's fresh frozen plasma shelf life and storage temperature is option A minus 18 to minus 55 degrees centigrade for 1 year, option B minus 80 degrees centigrade for 7 years, and option C 4 degrees centigrade for 24 hours, and option D all of the above. So the correct option is D, all of the above. Thank you for watching my videos.